Welcome to Adelphi, New York statewide breast cancer hotline and support program STEP video series. I'm Debbie Hughes, co-founder of Strength for Life, and today I'll be discussing how evidence-based exercise and strength training can support recovery, reduce treatment side effects, and improve quality of life for those impacted by breast cancer. In 2007, Strength for Life was formed as a nonprofit organization in memory of Evelyn Knapp, an exercise physiologist who continued exercising throughout her treatment plan. We provide free exercise classes and free weekend wellness retreats on Long Island to anyone impacted by cancer. Today's topic is the benefits of incorporating exercise into the treatment plan for anyone impacted by breast cancer. Exercise is no longer considered just a wellness recommendation. It is now viewed as an evidence-based component of cancer care. So what is exercise? There are 4 components of exercise: endurance, which is brisk walking, jogging, dancing, or singing; flexibility, the ability of a joint and the surrounding muscles to move through their full range of motion without pain or stiffness; balance, the ability to keep your body steady and not fall; and strength training, where muscles work against resistance in order to become stronger. Examples of strength training would be free weights, weight machines, or resistance bands. For today's presentation, my specific focus will be on strength training using resistance bands. Resistance bands offer low impact, adaptability, they're portable, allow gradual progression, they provide controlled gradual resistance, reduce joint stress, allow exercise in seated or supported positions, can be easily adjusted for intensity, they allow for slow functional movement patterns, and they are especially helpful during chemotherapy or radiation when energy levels fluctuate. Before discussing the details of a strength training program, it is important to understand why exercise is now recommended for those impacted by cancer. In the past, individuals with cancer were often told to rest and avoid physical activity. However, research over the past 2 decades has shown that appropriate exercise is safe and highly beneficial during and after treatment. Understanding the benefits of exercise helps explain why strength training plays such an important role in improving recovery, reducing side effects, and enhancing quality of life. The first benefit: it reduces treatment-related fatigue. Structured exercise interventions are associated with significant reductions in cancer-related fatigue in women treated for breast cancer. Evidence supports exercise both during and after primary treatment as an effective non-pharmaceutical strategy for managing cancer-related fatigue. It also reduces anxiety and depression. A large meta-analysis of randomized controlled trials reported that exercise significantly reduced depression and anxiety in breast cancer survivors compared with usual care. It reduces the risk of reoccurrence. Regular moderate exercise is associated with 16 to 24% reduced reoccurrence risk and 23% improved survival in breast cancer survivors with under as little as 150 minutes per week of moderate activity. With stronger effects seen with higher activity levels, over 3 hours a week of moderate exercise increases those results by 25 to 50% of lower reoccurrence and mortality. How exercise may help. It reduces estrogen and insulin levels. It reduces inflammation and body fat. It increases your immune function. The bottom line is regular moderate exercise is associated with reduced reoccurrence risk and improved survival in breast cancer survivors. Other benefits of strength training during and after treatment: improves quality of life, improves sleep quality, improves mood and self-esteem, improves response to treatment, improves immune system, and it improves your bone density. Now that we understand why exercise is important for cancer patients, based on the research and supporting evidence, let's shift our focus to the current exercise recommendations. Over the past several years, strong scientific studies have helped establish clear guidelines for physical activity during and after cancer treatment. Organizations such as the American College of Sports Medicine has developed evidence-based recommendations to ensure exercise is both safe and effective. These recommendations outline how often patients should exercise, how intense the activity should be, and what types of exercise are most beneficial. Let's now take a closer look at those guidelines and how they apply specifically to strength training. The current guidelines are 150 to 300 minutes of moderate intensity aerobic activity or 75 to 100 minutes of vigorous aerobic activity, or a combination of both. Examples of moderate activity would be light cycling, water aerobics, dancing, or the elliptical. Examples of vigorous activities would be jogging or running, fast cycling, swimming laps, aerobic classes, or hiking uphill. Muscle strength training activities at least 2 days per week. So strength training prescription, which is the FIT principle, include frequency, intensity, time, and type. The frequency should be 2 to 3 non-consecutive days per week of strength training activity. Intensity should be light to moderate intensity with a RPE of 3 to 6 out of a scale of 10. The time should be 20 to 40 minutes per session, 1 to 3 sets per exercise. And the type should be resistance band exercises where you target all major muscle groups, upper body, lower body, and core. Special considerations when engaging in an exercise program are fatigue, lymphedema, bone metastases, or neuropathy. With fatigue, you want to modify your intensity on high fatigue days. Shorter sessions are acceptable. Lymphedema, especially for breast cancer survivors, you need gradual progression, monitor swelling, and use compression garments if prescribed. For bone metastases, avoid high-impact exercises, avoid heavy lifting on affected areas. And neuropathy, emphasize balance and safety, seated exercises if needed. Here are some exercise-related risks and precautions. Fever, low blood cell count, or a recent change in treatment-related symptoms. You always want to take a common-sense approach to incorporating exercise into your treatment plan, and make sure to be under the guidance of qualified professionals when beginning a strength training program. And please remember, always check with your doctor before you begin an exercise program. Thank you for joining us. We hope you enjoyed this STEP program video. For more information, visit us online.